I think there are a number of benefits of using digital technology in our new plan for health and care services in Sussex. And it starts with being able to provide more advice, more easily accessible online for those people that are able to access the internet. I think then similarly the opportunity to book appointments is equally important and is another way for those people who've got busy working lives to be able to book appointments at a time of their choosing, not at 8:30 in the morning when the GP surgery opens. I think in addition to that, we need to then think about how people can express their preferences of how they want their consultations. Do they want them to be virtual or do they want them face-to-face? Do they want to be in a position where they can collect their prescriptions from a specific pharmacy or not? And then I think it's a case of joining up the systems will enable us for patients to be able to tell their story once. Because at the moment, what happens all too often is that people go to see a healthcare professional and have to start from the beginning of why they're there. And so I think by joining up our systems, which need digital technology and robust, secure information sharing, then I think we can actually genuinely make the patient experience so much better. Well, I think we've got to remember that data technology has continued to evolve really quickly in the last 10 or 20 years. The NHS in Sussex has already done a lot in terms of developing digital technologies. And just as an example, the NHS app is more widely used in Sussex than anywhere else in the country. And I think there's a lot of opportunities to extend the use of the NHS app to be able to book appointments and to be able to express preferences. Primary care, and also general practice in particular, is the bedrock of the NHS. And the 158 GP practices in Sussex delivered almost 10 million GP appointments last year. There's a massive demand for these services. Something else that we've been doing really successfully in many GP surgeries across Sussex is the use of virtual consultations. And then there's also another service around e-consult, where if you need a sick note, there's a facility in most GP practices where you can actually access that quickly and more easily without needing to go and have a GP appointment. So they're real practical examples, but we must always remember that technology is not the answer to everybody, because some people don't have access to a smartphone or the internet or a computer. So we also need to think about how we can make sure that those people are also served in this particular plan, because actually digital is the solution to some of our challenges, but not to all of them. I think there's a real opportunity within the NHS in Sussex to share our information more widely to other healthcare professionals in the system. You've got to remember the NHS is a huge organisation. In Sussex alone, we've got over 1,100 different locations and organisations delivering NHS services. So joining them up is actually really difficult to do when they've started off as independent organisations. I'm here today in a GP practice which have their own electronic patient record. But if that individual patient then needs a community district nurse appointment, or they need a call or a reference to a diagnostic centre, or they need referral to a mental health service, or even to a more specialist service in one of the hospitals, then we need to be able to transfer the request more quickly and more seamlessly with also the details of the patient. This has to be done really securely, but this is what we mean by joining up services, because actually that will make it a better experience and a better outcome for the patients that we serve.